Saima Server.
So I've been working as a nurse for 8 years. I graduated in 2012, and I've been working in long-term care for the last 6 years now. It's just what I like. I really like working with the elderly. I really enjoy long-term care and just the nature of the work. So it's been 6 years now, and I'm currently working at a nursing home here in London.
Wow. For both of you, I wanted to ask this question because, there will be a number of people who will be joining us. We have a number of people already, almost 14, 15 people are coming in, joining and appreciating what you are doing. And I will name few of us. But I truly wanted to say out loud that despite this crisis, despite this horrible news and a possibility of getting the chances to get infected, how you are keeping it up and keep it going day in and day out?
So I can go first.
Yes.
I think because being a physician, we do rounds once a week or twice a week. We're on call 24/7. But being a physician, I don't think I contribute as much as the nurses and the frontline staff, the PSWs and the laundry workers, people in the kitchen, people who are dietary aides, people who are still doing entertainment or coordinating the entertainment activities in the home. I think those people are the real frontline heroes who are going in every day, in and out. My job as a physician is to make sure that the residents, that we have infection protocols in place, that we have their medication sorted out, that we arrange things so that our nursing or care is appropriate according to the pandemic, so that the nurses don't have to go in multiple times of the day. So that's part of my job, working with the pharmacist, working with the infection control team. But I'm mostly behind the scenes. I just go in once a week or twice. But people like Saima who are there day in, day out, I really appreciate how they balance their life at home and work.
मुझे आपकी वो कहते हैं कि आपकी सेल्फ रिफ्लेक्शन बड़ी पसंद आई डॉक्टर शाजिया, कि आपने ना सिर्फ अपने आप को नहीं आप क्रेडिट ले रही हैं, आप दूसरों को भी क्रेडिट दे रही हैं. It's a very humble of you. Sister Saima, how would you describe your part of it in this crisis?
So for us, like, it started, I mean, right when the WHO declared a pandemic. For us in long-term care, it started right away. Our visitors have been stopped from coming into the home since before March break. So it's been quite a long journey for us. But I mean, in long-term care, we go for the residents. We have outbreaks all the time. For example, sometimes if people have a stomach flu, we have to isolate people right away because it's such a small community. The residents are so close. They share, bathtubs and stuff. So right away we put isolation protocols into place. So I mean, for us, although it's a very big thing on a large scale, when you're inside of the home, it is scary, but it's still, we take the isolation protocols. We take everything as we do before the pandemic. So
okay, mashallah. And I'm sure, yes, and I'm sure you have all the information. And I wanted to shout out the people who are joining us right now, Facebook Live. We have tons of people. Actually, we're really want to thank you. I'm reading one of the comment coming from Shazre Arslan. I really appreciate of the effort. Healthcare worker like you are the real heroes in this difficult time. We have Shams Sayyid Saab, we have Muhammad Shahzad, Dishan, Muhammad Hamoud, brother, Dr. Zahid Sardar, Heather Aman, and a number of Zeba Hashmi. There's a number of people joining us and asking those questions. One of the questions that came to me a little bit ago, how are the elders feeling in this crisis? Are they feeling like, scared, or they getting all that help? How they are feeling?
Like the people that are the seniors that are living at the long-term care you're asking about. So it's been very, very difficult for the people who are living there because we have essentially stopped all the families from coming in and visiting. And most of the people that are admitted in the long-term care, they're already quite frail, and already most of them, like 80%, have dementia. And they like to be in the familiar surroundings, but they also like to be with their loved ones. So it is very hard for the people or the seniors who are living in the long-term care, but that's what their nursing care is, and that's what the PSWs, they come in, because the PSWs and the nurses who are there every day, they're like their family. So they're like the second family. So they have an extra work now to associate, like they have to work as both the family and the nurses now. There are also programs in place where you can access, the families can call the nursing coordinators, and they arrange for laptops and Skype and FaceTime and all those things to get them connected. But I think, like Saima said, all the nursing homes have had outbreaks. We have influenza outbreaks once a season. We have gastrointestinal outbreaks. We have respiratory outbreaks. So we're kind of used to it, but just not just used to the families not being allowed to come in. That is really hard.
That's really hard. Sister Saima, how you are seeing that this is a good point, that the elders, the people, the residents of them, not able to see their family, how they are family and how they are dealing with this. And I'm sure with the social media aspect of it, it's not, they're not too much familiar with that.
Yeah, it's actually been very hard for the residents. I mean, normally in a nursing home, there's about 30 to 40 residents per 3 PSWs. So 3 to 4 PSWs, 1 nurse, and you're in charge of about 30 to 40 people. So on a regular day, it's very short. You don't have that much time to sit and talk and do extra, because your deadlines are all there already. So the families used to really help out a lot. They used to come in, take the extra time to sit with these people, to sit with their family members, to take time to feed. Sometimes, you know, they need help with feeding. Even us, we have days where we're off and you know, we're more tired. We don't feel like getting up and going to the dining room and things like that. So the families not being there has made a huge impact. A lot of the residents, like Dr. Shazia said, they do have dementia, so they don't remember. But when they see those familiar faces coming, like their family members, every couple days or every day, some of them would come. And then now all of a sudden it's been months and they haven't seen anyone. And on top of that, everyone who works at long-term care has to wear a mask. So now they see these staff coming and they're all wearing masks. So they are scared. They don't know like what's going on. We don't put the news on and stuff in like the common areas, because it's all about, you know, the pandemic and long-term care and the deaths. So we don't put that stuff on for them. It's really sad, because they are alone, they are scared. And then the ones that don't know, who have like that further along dementia, I mean, like for them, it doesn't matter, but their families are affected. So I get calls like, we'll be super busy, but then we have families calling us all day. How's my loved one doing? How are they doing today? Did they eat? And we love talking to them. We want to talk to them. But it's so hard when you have 30 people calling, and then plus you have all your other stuff to do. Plus you're doing extra work, because we have a lot of staffing issues right now, because we have either people are sick or people don't want to come to work. So there's just a lot of challenges.
Yes,
But
yes. So you know, I wanted to. I think that's a great point, and I wanted to say out loud. One of the hadiths is the best among those who bring greatest benefit to many others. And mashallah, you guys are doing it front. A number of people joining us. Sham Sayyid Sab has been, you know, asking us. Thank you, Arshad Gondal Saab, Ifkhar Ahmed Saab, Umair Mustafa, Zirak Zahir, Hamza Shah, Zeba Amber, Wahid, Sarvinder Singh Doli, Vikas Bulki, everybody is joining us, and wanted to thank you, all of you, for all your heart welcome, you know, the heartwarming things that you guys are doing. One of the question, and I ask all the viewers who are joining us live, please ask us the question. Both of these, my sisters, are at the front line, and they are doing amazing on behalf of our community, on behalf of our London, on behalf of being Canadian responsible health professional. They are actually making a difference. So one of the questions from Shams Sayed Saab is, uh, and this is probably one of the hardest one, is how is protection supplies such as masks, like PPE, you know, the mask, gloves, and happening within your long-term care facility?
Because my nursing home is in an outbreak, so we have adequate personal protective equipment now. It was a little bit slow to start with, and we started getting the PPE after we had our first positive staff. But
Mm-hmm.
so far, we've been lucky, and I think public health is dealing it well. Like they've been handling the
Dr.
situation.
Shazia, you were mentioning something about some status and numbers in terms of overall Canada and London specifically. Would you mind sharing with our viewers that they will understand where we are sitting in terms of this?
Like I was just looking at the numbers because we get daily emails
Yes.
about long-term care outbreaks. So I was just looking at the numbers as of April 24th, Friday. That was last updated. That 29.8% of the cases are in Toronto. Peel has 14.6% of the total COVID positive cases, and York region has 9.2. So GTA and Mississauga is dealing with 53% of the cases. In London, we have 2.6% of the overall cases of Ontario. So I think the public health has taken very good measures, and we've been able, like not just the public health, the people in the community, the nursing homes. We've been very lucky. We do have outbreaks. We have 6 nursing homes in London that are in an outbreak, but we have been very lucky that we have not had as bad circumstances as different nursing care homes in Toronto or GTA where they have called in the military for help.
Okay, okay. And Sister Saima, you know, one of the things you actually mentioned that there's some shortage of, the nursing staff, PSW, some off sick, and some might be under stress or in that nature. And we have heard some more in Quebec. Are you seeing here in London, Dr. Zahid Sardar put this question, we seeing here in London in a greater vicinity about the shortage of staff?
Oh yeah, 100%. Where I work, there's 7 cases of COVID. It's in one unit, so we have 6 units. So they're all in one unit. So they're contained to that. But I mean, it's scary for everybody in the entire building. So on top of that, the Ministry of Long-Term Care, right a few months ago, they put out a rule that if you work at multiple nursing homes, you cannot anymore. You have to pick one. So when that rule came out, we lost a lot of staff because they chose, either the one or the other. So we
Okay.
lost staff there. And like, I mean, we've had problems with staff shortage from before the pandemic. So now it's like even worse. We have managers, like our DOCs, our administrators are all working as nurses. We have people who are working double shifts daily, like full time. Plus, on top of that, they're working doubles. I mean, the shortage it's beyond words, like how bad
Mm-hmm.
it is. We have like as much staff as they have, they're using them, and people who aren't coming in, they're offering overtime, they're offering to pay them double time and a half just so they come in because they need people there. Like, where are these residents going to go? And they're still not being able to, whereas managers are working 8 days in a row, they're working doubles, they're working on the floor. I went to work last week, I had to work a double shift, and then
Wow.
on my breaks they asked me to go do meds on another unit because that unit had no nurse. And I was like, what do you like? I'm not a robot. I can't work on my break and do a 16-hour shift. So like, it's that, like, you feel bad and you want to help, but we're human. Like, how much can we do? Like,
Yeah.
when you work
Well,
when and you
I truly appreciate, and this is something which everybody is appreciating you, and I'm sure all the resident. I have Naveedul Hassan, Muhammad Ashraf, Zubair Talha, Hamza Shah, Labed Qazi, Arshad Gondal, Iqbal Sheikh, Sanjay Singh, even community from outside of our Pakistani community of Afroz, Khizr, Tuba, Kaleem, Rehma, Sayed, Kasser Rahman, Samara Hassan, everybody is watching you and actually saying thank you for working and stepping ahead of that. We just joined with Uzair Malak and Brekna Maksud. They both are also joining in and saying thank you. Doing the double shift in terms of crisis is it's unprecedented. It's very hard, I'm sure, with all the fear coming along. Now, here's the question some of us has sent us earlier, who have elders at their home. Would you both of you kind of elaborate or give us a tips that how they can keep these elders protected within their own home while living it all together within their family?
I would, oh, sorry. I would say the main thing is like to keep yourself safe. Because I mean, the elders, they don't go out as much. You are the one who's gonna go out and do the grocery shopping, meet whoever, and you will be potentially the one bringing it home to them. So it's important for you to keep yourself clean, wash your hands, avoid going out if you have to. Even like if they have like routine doctor's appointments and things, cancel those until later. There's no need to go out. Wash your hands. Just avoid traveling. Stay hydrated. Stay home. Like it's like for everybody. Stay home. The more you stay, the less exposure you have, the safer you'll be.
Mm-hmm. Dr. Shazia Khan, although I know stay home is one of the great thing to do it, but again, if we are running as a family, we have to go groceries, we might have to go to medicines. What else we should do in order to protect our elders who are living with us within our family?
I think it's the same, exactly what Saima said, that first, anyone who's going out has to make sure that they're doing the infection control measures. So basically, if you're going out for work or if you're going out for grocery shopping, you have to make sure that you have that safe physical distancing, that you're wearing a mask if you're going out. And even at home, if you do have symptoms, and not only for older people, but anyone at home, if you think that you have any of the symptoms, which might be fever, cough, any upper respiratory symptoms, then try to avoid or try to self-isolate yourself even at home. Especially if you have older people, the older people may not have the same symptoms that younger people have. So an older person may not have a fever, may not have a cough, but if you find that there is a change in behavior, if there's nausea, vomiting, diarrhea, I've seen people, like in my nursing home, I've seen patients who tested positive later, but we found out because somebody fell, and which was like usually they fall, they have higher risk of falls, but then somebody fell and we said, well, let's do a COVID testing done and let's find out. So at home, you don't have that testing readily available, but you have to make sure that if anything changes, if mom or dad are feeling tired more than their usual, or if they have diarrhea without anyone else at home having the same symptoms, if there is anything unusual that should raise an alarm, there is something wrong, call your doctor, call your family doctors. All the family doctors are available over the phone. Offices may be closed, even the walk-in clinics. Like I saw the walk-in clinics up on Adelaide, they have signs up that they are open for phone consults. So there is no, you cannot say that your healthcare is not accessible, so it's still accessible. As soon as you find that there are any symptoms, then you try to contact your family doctor or contact the walk-in clinics, get the help that you need. You don't have to go into emergency unless somebody's looks seriously unwell. So if they have shortness of breath, if they're finding it difficult to talk, if they feel really tired, dehydrated, then it would be the time to go to emergency.
Well, beautiful. I think those are all general rules, and which is very much, and if any of you have, we have number of people now joined more. We have Ghazala Ijaz, Wakas Balki, we have Wahid Mirza Sahab, Muhammad Jawad, Naseem Iftikhar, Shams Sayed. Naseem Iftikhar was really appreciating and appreciating for all of your effort. While I have you here, Dr. Shazia, could you share with us, one of the questions came in that how long it takes to get the result testing for the seniors or the other regular people these days?
So the public health has changed the guidelines so many times that I've lost track. I ask the patients, like, because I work in the community too. So I ask my patients, if you have any symptoms, call me. And if they call me and I find that they look like a presumed sick case, I say, I don't know what the guidelines are today, so just go into the COVID assessment centers and get it checked out.
I think
Okay.
it's a couple days because they
First,
tested people on Sunday, or sorry, on Friday, and they've already got results today. So I think it depends. Like they're prioritizing which results they get sooner than other ones. I know in our nursing home, on the unit, if you're working on the unit that has the COVID cases, your results come back within like a day or two. But if you're working somewhere else, they won't necessarily like test you. And then I know people in the community who got tested and it's been weeks and they haven't got a response. So I think they are prioritizing who gets tested and how fast you get the results as well.
Okay. And one of the question came in from Zishan Muhammad. Is everybody getting in these long-term care homes are tested?
yes.
Mm.
In my nursing home, because we're maybe because we're in an outbreak, but I think the general guidelines from the ministry is that, or the public health is that, any resident or staff in a long-term care home, if they are suspected to be positive for COVID, you would get the testing right away. Over the weekend, the situation is different, so they may be swabbed, but the results may take longer. But over the weekdays, if you get the testing done, the results may be available in 24 hours.
In our home, everyone had to be tested. This was new. They just announced it on Friday that every single person who works and residents have to be tested, and they did get tested.
Okay. Okay. That's something. Now following question is, and before I ask this question, I wanted to shout out Halda Ahmed, Arif Wasim, Bhavan Patel from our South Asian community joined us. And relevant question is, if one get positive, do they still stay in the same long-term facility, or they moved out, or kind of get in isolation within the same facility or somewhere else?
They stay within the same facility, like they stay in their room. A lot of the nursing homes now are people have their own private rooms. They'll either have a private or a double. So if it's in a private, they just get isolated to their room. And that's what they've been doing. They just isolate them to their room.
Okay.
My nursing home too, it's the same. If somebody's in a quad room, like we had 2 cases who were both in a quad room, which means there are 4 other residents there. So the resident that was positive was isolated into a different room. And even those who are not positive, ever since the public health has sent guidelines, so every single resident is treated as if they're on an isolation precaution.
Okay. Now the one of the other question is that they are if they are in home, like some of our community doesn't want to work with the long-term care home. The elders are staying in our home. Do you recommend them to bring him to the long-term care, or within the home they can do this same self-isolation with the physician, with the medical professional help?
Because the long-term cares are a more confined environment with a lot of people, so they're more at risk of getting infections. So if somebody is at home, that would be the best place to be. Even people from our regular residents at long-term care homes, some of the families made that decision that they're going to take them back home for the period of the pandemic, and then they will bring them back, because the chances of them getting infected because of the short staffing at the nursing home, the chances of them not getting the appropriate care, I think it's better to keep them home.
Okay.
Yeah, I agree. To keep them home. I mean, the staffing is already shortage. And like Dr. Shazia said, the risk of getting it in a long-term care is far greater than at home.
Okay, wonderful. Now, one of the question came in, and which is something very key point, and I think some of us have addressed it. But Arshad Gondal put up the question: in this pandemic, we have heard from everyone to remain hydrated and drink a lot of water in order to keep your immune system up. But with Ramadan going on, with fasting, we can't do this. So what's your recommendation in terms of clicking our immune system?
So there was one of the studies which was just when the Ramadan started, it was in the media circulation a lot. Intermittent fasting, the studies done on intermittent fasting that show that the intermittent fasting boosts your immune system. So basically, Ramadan does not stop you from doing whatever you've been doing before. People do intermittent fasting for diet. You can also do it for a religious purpose. And it does not affect your immune system. You can still stay hydrated. We're not living in countries where the temperatures go above 45 degrees. We're very fortunate. We're living in a country where we have very controlled temperature environments. We're not usually dehydrated unless sick. And Allah has given us the relaxation to not fast when we're sick.
Indeed, indeed. I believe we understand and we believe in this, that Rosa basically is purify your body and detoxify it, so it should not be there. One of the question from Wakas Bulky were, what are your expectation about the curve flattening in Ontario and more specifically in London? Are you hearing positive news about this, that we are kind of on the downtrend of the curve of coronavirus within London?
Within London, I don't know the specific numbers, but I know that the numbers are decreasing. So there is a very good blog that I follow myself. It's Dr. Appleton. He's running a room info blog, and he puts out updates every 2 days, 3 days. If you're really interested in room info, you can always go there and find out. But there are daily parameters, daily numbers, and he puts them in very nice graphs. The trend is obviously the curve is flattening, but it is flattening because we're all doing our part. So all of us, not just the physicians, but people in the community. So we'll see how the trend goes. We cannot predict unless they ease the restrictions and we go into it slowly.
And I think today there was like 400 new cases in Ontario just today. So I don't think we've hit it seems like it, but there's nothing certain yet that we've hit the peak or.
Okay. One of the questions came in, and I think it's very relevant, and I actually did another show on that, in mental health, and specifically with long-term medical health. I'm sure staff is facing some really, really stress times, as well as the resident, as well as their families. How are you coping with all the mental health, and what do you recommend for the viewers who are joining us in terms of thinking healthy, thinking positive? There is an end of this pandemic, and we will come through. As we are fighters, as Muslims and human beings, we will come through over there. What do you recommend for these people?
My way, whenever the patients ask me, because the most phone calls I get in the community are either about, I have a cough, do I have COVID? Or I'm anxious because I want to go back to work, but I'm anxious that I will get it. So my advice to most of the patients that I talk to is stay off of the news, stay off of the TV, don't watch anything negative, and try to think about the positives that you have. You have more time with your family, you have more time, you have opportunities to go online and talk to your friends as well. You have more time to yourself to look after your own personal health, and Ramadan obviously to look after your spiritual health. But also in the long-term care, I think Saima will speak better to it. The families of the frontline workers, I think the families are more scared and you are scared and you feel guilty that you might bring the virus home. So I think I would let Saima talk about it because she's there day in, day out.
I think, thank you. I think for the workers themselves, it's really a matter of not getting burnt out. I see a lot of people are getting burnt out. They're tired. Like the management, I know they're doing as much as they can. They are working harder than probably everybody. But at the same time, the people that are coming to work, they're being stretched so thin because there's so few of them and there's so much work that they are getting burnt out. So I feel the people who are working, if you go and you see, they're the people who truly care, and they're there because they're there for the residents. They love their job. They go every day, knowing they're making a difference in these people's lives. And I mean, we just take it day by day. Like every day you go, you do your tasks, you get everyone fed, you get them changed, and nobody died, nobody's sick, and nobody, you just kind of take it day by day and look at the small things as your goals. Like, okay, I got to this point, let's go to the next one. Okay, we made it to lunch, now let's make it to the end of shift. And it's kind of step by step, and just keep going and take it one step at a time, day by day, and make dua. And now with Ramadan, there's lots of, it's tiring because you're hungry, but at the same time you have this inner peace where you feel like, okay, it's okay. And
It
I
is
think,
tough. It is tough, and definitely keeping all your momentum is quite energetic. And I wanted to appreciate. And I have number of people who are appreciating you. Tuba Kaleem mentioned. Thank you for mentioning key points which some of us were missing. Uh, Sohail Qazi, Usman Mehboob, Muhammad Numan, Naeem Faruqi, everybody joining in, and thank you for being out there. And I know Dr. Shazia Khan is actually on call, and she might get a call, and we only wanted to schedule it within 30 minutes and wanted to share with you how they are making a difference, and just a brief review of our local heroes who are actually meeting. And please do comment them, do give them appreciation, the appreciation they deserve, the appreciation of being working frontline while we are all in self-isolation and doing to protect ourselves, which is great. But then there is another mindset, another personality comes in that they go beyond the manual thing of it in order to help others. And I truly appreciate. At the end of it, I wanted both of you, my sisters, give one advice, one message to our community, specifically in this COVID-19 crisis. What would you like to say?
I think you keep on saying, everyone keeps on saying thank you, thank you, thank you. So I think I would take this time to thank everyone else in the community, because the doctors, the nurses, the staff, the public health, the ministry cannot do everything or anything at all without the help from everyone else in the community. So we're flattening the curve because everyone is doing their part. So thank you, everyone else. We're just doing our job. We're not doing anything heroic. So just keep this up, and Ramadan Mubarak to everyone.
and I just want to say the same thing, like what Dr. Shazia said, that it's the community has come out so much. So many people are making masks, making headbands. I've gotten so many messages from community members asking if we need anything, if the staff members need anything, if we need anything at our nursing home. And just that show of support, it means a lot. It makes us feel like we're not in this alone, that we are in this together. There is, hope, and we really appreciate. And like Dr. Shazia said, we're just doing our job. We don't feel like heroes. We don't, like, I feel embarrassed with everybody saying thank you, because I don't feel like I'm doing anything different. We're just doing our jobs. We do this every day. It's our normal routine. And yeah, it's a little bit harder because of the circumstances, but you still kind of have to do it. And I just want to say thank you to everybody for listening to us and for asking questions, and just keep remembering everybody in your prayers. And thank you.
Mashallah, mashallah. Being humble is a great strength you have. And this info series is brought to you by PCA London, Pakistan Canadian Association of London, where we actually will bringing a lot of personalities within our community who are doing something out of ordinary. And this was one of the first series, and a great local heroes come on board and sharing with us with their expertise. And I'm sure you get away with some of information, some knowledge and skill. And most importantly, I wanted to appreciate both of my sisters who are doing amazing. And these series we will continuously will be doing on Sunday and Friday every week, and bringing it to you live. Please like, share, and do join us on these sessions, because we wanted to bring all of our local heroes out there in public and share with you. Some of you might have heard, some of you might not heard, and some of you might get benefit in all areas of your life. And I wanted to end this telecast with one of quotation from Ralph Waldo. The purpose of life is not to be happy. It is to be useful, to be honorable, to be compassionate, to have it make some difference that you have lived. and you have lived well for others. Thank you so much for joining us on Facebook Live. I truly appreciate all of your comments and everybody shared. Thank you with you, and look forward to see you again. Inshallah, and Allah Hafiz.
Allah Hafiz.